The theme for this year's conference is Zamfara State and Twin Tragedy of Insecurity and Medical Brain Drain, the Nexus and Way Out. The team was carefully chosen to brainstorm on how best to tackle the most daring tragedy in the healthcare sector in Nigeria. Medical brain drain is popularly known as Japa syndrome in Nigeria. This is a situation where our highly skilled medical professionals leave the shores of Nigeria in search for greener pasture. This has greatly affected the healthcare sector in a negative way. In addition to this, in Zamfara State is a twin tragedy in which Japa syndrome is complicated by the ravaging insecurity. The sub-theme for the conference is on how to prevent perennial cholera outbreak in Zamfara State through a multi-sectoral approach. This becomes imperative, looking on how year in, year out, we are battling with cholera outbreak with its attendant consequences. We wish to acknowledge the giant steps being taken by His Excellency, the Executive Governor of Zamfara State, to reposition the health sector with recent renovation and upgrade of hospitals in the state. We are particularly happy with the decision of the government to renovate and equip Ahmad Sani Yariman Bakura Specialist Hospital with modern equipments. This will go a long way in resuscitating the hospital back to its original position as a specialist and tertiary hospital that can compete favorably with tertiary hospitals in other states. We also want to particularly appreciate His Excellency for enacting the 30,000 Naira minimum wage for civil servants and for setting a committee to review the salaries of doctors and other healthcare workers in the state. In view of the prevailing security situations in Zamfara State and other neighboring states, we are recommending as follows. We want the federal government to, as a matter of priority, intensify the fight against banditry. We want to state categorically that the situation is getting worse by the day and has overwhelmed the already fragile health system in the state. We wish to recommend that federal government change strategy and look at the possibility of moving a significant military operation command to Zamfara State. While appreciating His Excellency the Executive Governor for all he is doing for the health sector, we want to urge him to consider reverting the present status of Ahmad Sani Yariman Bakura Specialist Hospital to its original semi-autonomous status. This step will certainly go a long way in addressing the challenges being faced by the only tertiary health institution in the state. In Zamfara, in addition to this common Japa that affect the whole of Nigeria, we have an additional one. A lot of doctors are leaving because of the insecurity. Some due to family pressures, that their family, they are afraid that something can happen to them while in Zamfara. And we had sporadic cases of health workers being kidnapped in Zamfara State. So within these our 2 years, we do not have any case as such. But a lot of doctors, their families are showing concern. And some of them, they bow to the pressure and leave and go to other states. Giving you a statistics is very difficult because it is a daily affair. But however, in the last month, Ebinya Rimon Bakura lost about 10 doctors that left the state service to federal service because of the problem of the welfare package, the pay, though the state government is doing everything possible to see that the state doctors in the payroll of the state are being paid salary that can be at par with federal government, and our equalization of the salaries, and that will reduce that. But this is how far I can tell you that. But we know many doctors have left the state.